TTR is disclusion time reduction. So all that it really means is how the teeth come together. This is where she's hitting just a little bit too hard. When it's improper or too forceful, it creates the problems that we see with the muscles in the face. My name is Dr. Bethany Brenner. I've been practicing since 1980. These people suffer so much.
Severe facial pain around my eyes.
So when I get my migraines, it's usually up through here in the forehead down into the temples.
I was having, jaw pain up into my ear, grinding.
Neck pain, jaw pain, shoulder pain.
I'm on a daily medication for the migraines, but they would still break through.
I got to work every day. I got kids, I got grandkids, I got animals, I got a husband, a house. You just go on doing your everyday stuff. Motrin, Motrin, Motrin.
When I went to the oral surgeon and he talked to me about jaw surgery, I called Dr. Brenner right away. I said, hey, this guy wants to go in and drill in. And I said, I'm not ready to do that. Well, I certainly was having mouth discomfort. We were having some clenching problems, jaw problems.
So when we start this process, people all of a sudden feel a relief in their face. Most people say the migraines go away right away. So we're going to put what we call EMG leads on the muscles in their face. Then we're going to have leads that are hooked by USB into a computer. And then they bite on this sensor. Go ahead, bite down. As we click it on and they bite down, I actually am recording the function real time of what's happening in their mouth. I can actually measure the function of the muscles of the face. That's not a guess anymore. Now I know where they are. That changed everything for me. I said, oh my gosh, this is good science. We're still a little too strong on these back teeth, but we're very balanced.
The technology it's mind-blowing, I would say, when you're able to sit there and see your bite in real time and see how it impacts on a screen.
You'll see peaks and points on it that'll show you, and with the calculations, whether you're balanced on one side or the other. Of course, it depends on how many teeth are in contact. Then you have how hard the strike is on the tooth. That hardness, that force, actually creates trauma.
She says, I'm just taking very little minute adjustments. And then she has you bite down and she checks you again and checks the bite. The alignment seems a little bit better.
I'm looking at that scan as I'm adjusting. I'm trying to get them all centered back onto the tooth, appropriately balanced. Some people have said to me, well, how much are you taking off my tooth? I said, microns. This isn't grinding your teeth flat. This is a slight reshaping to give you the proper contact. And so what people tend to say to me at the end is, oh, that feels smoother. Oh, I can glide easier. Oh, that feels better. Oh, the muscles in my face don't feel as tight. And that's all within a few minutes.
On a day-to-day basis, I'm pain-free.
She's flat, muscle goes into activity and she's flat. She's not spiking out here. So when the muscles are all inflamed, we're gonna see lots of little funny spikes that are coming up off of that. So she's really doing well.
And when she would grind down, every little bit that she did, do a little bit at a time. And I can wake up and I am pain-free.
Since we started, I haven't had a migraine, which is huge for me.
You ready? Mm-hmm. Close, open, close. Brittany, her teeth they look pretty, but she actually has no contact on her canines or her front teeth. When someone doesn't have any contact there, they're only striking on their back teeth. That fires off the muscles in the face. So when she had the car accident, had the damage to the face, I'm thinking, ooh, let's test her.
My car rolled, so I hit my head on the adjuster for the seatbelt. I had a really bad concussion. I had a fracture of one of my facial bones.
So let's add on some composite filling material to the inside of her canines to get her to contact. As soon as she had that contact, and now I'm able to balance her bite because her joint is relatively stable at this time, she had an immediate relief of the migraine. She didn't get another migraine.
I was very surprised. I never knew that this was an option. I thought, okay, I clench and grind, I need a night guard. So that's the classic treatment. That's what's been pushed on people forever. Knowing that there are alternatives that actually solve the problem rather than just kind of put a Band-Aid on it is nice.
To think that this is not out there to every dentist, or that every dentist isn't going, oh my God, you know how many patients I have that are experiencing this pain and everything I've done? This needs to get out there so everybody can hear of this and get treated.